So, good afternoon, students.
Good afternoon, sir.
Okay, so any questions? So, I hope you remember yesterday during our class, we were talking about serum, right? So, we talked about blood, we talked about the blood components, right? We talked about serum, we talked about plasma, we talked about anti-serum, right? So there were so many terms that we used. So today again, so this is part of your practical, right? So one of your practical is serum separation, right? And if you remember, we talked about its significance, right? And we discussed how we take out blood from a person, right? So we already discussed so many things. So today, what we will try to understand is, or actually see, because you cannot do it, but you can see how we separate serum. Okay, so usually when you go to a diagnostic center, so blood is directly taken out from your vein, right? So from that blood, serum is separated, right? So we will understand that process, how we separate serum. Okay, so I think before, again, first I will show you a video which shows the difference between serum and plasma. Okay, so again, it will refresh the difference between serum and plasma, and then we will see how we can separate the serum from the blood in laboratory. And then we will also discuss what are the precautions that you need to take while carrying out this procedure. Okay, so we are going to discuss all those things, but I think before uh, we do all this, uh, just to refresh, or just, yes, just to refresh what we learned in the last class, we'll have a small quiz first. Okay, so from that quiz we will discuss those points. Okay, so if you are clear on those points, only then it would be easy to understand what we are going to do today. Okay, so let me just assign that quiz to you. Okay, so I have assigned that MCQs to you. So I'm sure it is now visible at your end. Is it visible?
Yes, sir.
Okay, so students, start doing it, because what we are going to learn today, so first we will discuss the answers in this MCQ, and then we will talk about serum separation, the practical aspect. Okay. So I think Nandini and Adish have not joined. So students, almost half of the class has submitted the response. So others do it fast. So students start submitting now. So four more students have to submit. Do it fast. Two more students have to submit. Students, do it fast. Okay, I think we can discuss the answers now. Okay. So the first question was, okay. So the first question was, which of the following statement is true concerning human blood? Okay. So 18 of you have given the right answer. It's the first point that the blood of all normal human, it contains the red cells, the white cells, platelets and all, right? So that is the correct answer. Uh, Question 2 is, which of the following blood component provide the major defense for our bodies against invading bacteria and viruses? Correct answer is the white cells, and all of you have given the right answer. Question 3 was which of the following are likely to increase in quantity, right? So we are talking about numbers. When the body is under attack from bacteria, and the correct answer is leukocytes, right? So leukocytes basically they are part of the white blood cells. So when there is an infection, these leukocytes their number will increase, right? Because at that point there is a need. So when there is an infection, there is a need for these cells, so their number increases. Okay, and I'm sure जब तुम blood test करवाते हो तो उसमें leukocyte count भी होता है, right? So it tells you whether the number is up or down, right? So antigens are found on the surface of uh, yes, they're found on the surface of red cells, right? So that is the correct answer, right? Antigen is not the kind of red cell, right? So answer is the first one, found on the surface of red cells. Question 5, the appearance of plasma is, so the good thing is all of you know it is yellow in color, it's pale yellow. Question 6, in blood of mammals, plasma, so the correct answer is the fluid part of the blood, right? So uh, when you let it, when you let the blood coagulate, right, it settles down, right? So the coagulated thing, the jelly thing, it settles down, and rest is the fluid part, which is your plasma. Okay. Question 7, plasma does not contain, the correct answer is erythrocyte, right? So plasma contains antibodies, and they are the serum albumin, globulin. So they contain all these things, but they do not contain the erythrocyte because that has coagulated and it has settled down. So uh, plasma does not contain the RBCs, and therefore it is yellow in color, right? But suppose sometime what happens if those RBCs uh, they break down, then you will see that the plasma also becomes bit pink in color. Okay, sometimes. Okay. Okay. So uh, in some questions you have not done well today. Okay. But overall, yes, you have a good understanding of uh, the serum plasma, right? So before I start with that, do you have any questions, students? I think there were a few questions yesterday. Any questions?
So I have a question regarding today's quiz.
Mm-hmm.
So you know how it says antigens are present on the surface of the red blood cells, right? But yesterday, didn't we learn that the MHC are what present the antigens on the surface? So shouldn't it be on the surface of the MHC and not on the red blood cells?
No, no. Uh, uh, see, MHC is presenting a peptide to the T cell, okay? But the antigens, so see, again there are two things. There is humoral branch, there is cellular response, right? Cellular response is secondary. First, what happens? The antibodies they bind to the antigen, right? So antigen has to be on the surface of the pathogen. Okay, if that antigen is inside the pathogen, it will not be recognized, right? So uh, the first thing is to have the epitopes on the surface of an antigen or a pathogen. So antigen is basically on the surface of the cell. Okay, and what we learned yesterday, so MHC, they are taking a part of that pathogen and activating the T cells. Okay, clear?
Yes, sir, it's clear. It's clear.
Okay, okay. And Manaswini, yesterday you had one more question, right? It was like when you go to the lab and your blood is collected, okay, and then they transfer it to different vials, right?
Oh, yes, sir.
Yes. So what's the answer for that?
So I don't know. I mean, when I was just explaining the, taking out of the blood, I just said that they take separate vials. Others,
Okay,
I
okay.
don't.
So students, I will explain this to all of you why when the blood is collected, it is transferred to different tubes. So let me just share one image with you, and it will be clear to you. Okay, can you see this image?
Yes, sir.
Okay, so you can now see that there are different types of vials, right? So, and those vials have different colored caps, right? The tubes have different colors. So, why it is put or transferred or distributed into different tubes is that it all depends on what kind of test have been recommended, right? So you can see, like, just for example, this blue tube, right? It contains sodium citrate, okay? And suppose if you have, if the doctor has asked for blood clotting factors or PT-INR test, okay? So the technician will put some part of the blood in this tube, right? Now suppose there are some serology based tests or immunology tests that have to be conducted. So your blood will be added in the red tube, which is not containing anything. Okay, it's a plain vial, right? So there is no additive in this tube. Okay. Similarly, if you have to do biochemistry test, right? So it will be put in gold or yellow vial, okay, and it has this serum separating tube. It's a serum separating tube because for biochemistry test you need serum. Okay, so that's why we usually use the yellow vial for this. So for different kind of tests, so like this green vial, it contains heparin. It is used for some special test to identify trace elements. There is a lavender tube, so if you have to conduct some blood bank test, right? ESR and these kind of tests, then it is put in lavender tube. And if you have to test blood sugar, your sample will be put in a gray wine. Okay, so just imagine you went to the doctor and doctor has asked for blood clotting factor, some biochemistry test, and your blood sugar, right? So the technician will take your blood and put it in light blue, yellow, and gray tube, right? So depending on what tests are advised, and now just suppose the doctor has only asked for biochemistry test, so the technician will take your blood and just put it in one vial, okay, which is the gold or the yellow vial, right? Clear, students, everyone?
Yes, sir. Yes, sir.
Yes, sir.
Okay. Okay. So earlier, these tubes were not available, right? So if you go like 10, 15 years back, then there were glass tubes, right? So the blood was collected in those glass tubes, and then it was sent to the lab. And in the lab, there were different vials. So they would separate, so they will distribute that blood in that glass vial to different test tubes and do the test. Okay, but now we have these vacutainers, right? I hope you know what are Vacutainers. So, do you know what are Vacutainers? Anyone? Have you heard this term, Vacutainers?
No, sir.
No, sir.
किसी ने नहीं सुना?
No, sir.
Okay, let me find an image for it. So I'm just trying to find an image of Vacutainers. Okay, so students just see this image, right? This is the traditional way of taking out blood sample, right? So what you do, you prick, and then in this syringe, the person pulls it, and the blood gets collected here, right? This you know, the needle and the syringe.
Yes, sir.
Yes. Now there is another system which is vacutainers. Okay, so vacutainers are something like this. Okay, now just see here what they have done is they have put this tube here, right? This tube you can see in this picture, it's the yellow or the gold cap, right? In this, it's the lavender one, right? Now here what you need to do is just prick in the vein, okay, and blood will automatically start coming into the vial because a vacuum is created, right? So in these tubes a vacuum is created which will automatically start pulling the blood, okay. So in this case the person do not have to pull the syringe, right? Clear? So you can see these are the vacutainers, and if you have recently given blood, so mostly in big hospitals you will find that vacutainers are being used rather than these syringes for collecting blood. Okay, clear?
Yes, sir.
So any questions?
No, sir.
So,
Yes.
so in these, if you want to do like three tests separately, so you will have to collect three different times.
No, no. What we do is, uh, okay. So they will, the technician will keep three different vials there, okay, and they just remove the vial and they'll put another vial, okay. So it's not that you'll be pricked three times.
Okay, sir.
Or sometime what they do is they take it in the plain vial and then they put it in different vials. Okay. Okay, I think now, okay, just hold on. Let me find. Okay, let me show you how we collect blood in a Vacutainer. So you can see here that the doctor is having the Vacutainer and he has put this uh, gold vial here, right? So students, you want to see this again? In this, uh, the blood came automatically, okay? And you can see two tubes, the yellow and the red one, right? And the person was not pricked again and again, only the vial was changed, right? So if you want, I can play it again for you. Okay, students, again, I just want to show you one thing. If you see this vial, right, you see there is something here, right? So this is uh, the reagent that they have added, okay, which will help in serum separation, right? And if you see this red vial, it does not have anything. So it's the plain vial and it's the serum separating vial, right? Okay, clear? So now you are aware about this Vacutainers. So
Yes.
don't be surprised. So whenever next time, suppose if you are giving blood or if you see the blood being collected by this method, don't be surprised. This it's a very common thing now. Okay, a lot of hospitals are using this way of collecting the blood sample. Okay. Okay. So any questions?
Sir, the place where a needle has been placed for taking out the blood, is it the specific place in our hand, or like any we can take it from anywhere in our place?
Uh, Question repeat करोगे एक बार?
Sir, is there any specific region in our hand from where we'll take out the blood?
Okay. 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 I'll just tell you. Uh, okay. Uh, Let me show you the image again. I'll show you another image. So the first thing is, so you see these veins here.
Yes, sir.
So these are the sites from where you can actually collect your blood. Okay. The problem is like in this person you can see all these veins, right? But in a healthy individual or a person who is having more fat, it's very difficult to find these veins. Okay. Uh, so the thing is, you have to, you can see here, right? So you have to uh, put this vacutainer in a specific vein, okay, for collecting the blood sample. So it's not that you can collect from anywhere, it has to be collected from a specific site, okay. So I think the most preferred one is this median cubital vein, okay. Okay, so I think it's clear now.
Yes, sir.
Okay, and students, we are not aware of it, but the technicians who take out this blood from the patients, okay, they know different sites. So it's not only the arm vein, right? There are some other points from where you can collect the blood sample. So if you will see that in infants, the blood is collected from the veins here, right? Have you seen this?
Yes, sir.
Right? And in some old people, the blood is also collected from the veins near the ankle, right? So suppose if the technician is not able to get the arm vein, right? So they can try a vein in the ankle, okay? So obviously we don't know much about it, but yes, there are different sites from where you can actually collect the blood sample. The preferred one is the arm, right? But you know, in a lot of people you will see it's very difficult to find a vein, right? I have seen even the technicians who are taking out blood almost 100 people per day, right? They also sometimes it becomes difficult for them to identify the vein, because sometimes because of the fat, right, the vein gets embedded, right? So it becomes difficult. So you like we put the tourniquet, right? So the purpose of that is that the veins will swell. Okay, sometimes the technician will ask you to do like this, right? So that the veins they swell. Okay, so that it becomes easy for them to find the vein, right? And even I have collected blood from the patients. So I know it seems to be very easy, but sometimes it gets very difficult, right? And I remember when like I had to collect patient samples, right? So for that, I was going to the hospitals and I was going to the wards or OPD. And sometimes what happened, the patient is there, but the nurses or the technicians, they are not there, right? Or sometimes they will say that we don't have the permission to take out the blood, right? So in that case, it became very difficult for me to get the patient sample. So the technician in my lab, she said that, okay, I will teach you how you can withdraw blood. Okay. So she explained me the procedure, and then I wanted to test if I can actually do it. So I was thinking on whom I can try this. So she volunteered and I pricked her 3 times. And just imagine like someone volunteering to agreeing to being pricked uh, from a person who actually don't know how to take blood, right? So I pricked her 3 times to learn this method of withdrawing blood, okay? And then after a week, I went directly to the wards and collected the blood sample from the patients, right? So that made my life lot easy. So I think if any of you in your future you are going to some hospital for your research, so I will suggest that you learn this technique of withdrawing blood. So it becomes very easy to work with the patients, right? And you can always get a certification from someone in a particular lab, maybe from the blood bank or somewhere, so that you don't face any difficulty while you are collecting the blood sample, right? So I think those who will be in this line, they should learn this technique, right? Okay, so any other question? Okay, students, what kind of precautions you can think of while uh, withdrawing blood? Anyone?
Sir,
Okay, I see one hand of Manaswini. Any other person? Okay. So what I'll do is, I can see two hand, Manaswini and Yuvraj. So both of you can give me at least 1 point. Okay, I can see one more hand, but okay. So Manaswini, only 1 point that you can think of. Just switch on your camera, all three of you. Okay.
So am I visible?
Yes, all three of you can switch on your camera. Yes. So Manaswini, what is your point?
Sir, the needle should be properly sterilized and fully clean.
Okay. So the needle should be sterile and clean. Yuvraj, what's your point?
Sir, it should be site specific.
I didn't get the point.
A specific site of withdrawing blood.
Manaswini, could you get what he said?
So he said the blood has to be drawn from a specific site, right?
Okay. And Adish, what's your point?
The person who is drawing the blood should not shake his hand too much. He
Okay.
should have a stable hand.
Okay, so apart from these point, any other point? Okay, okay. So I'll discuss few more points. So you can switch off your cameras. Uh, so one point was that uh, the needle should be sterile. Okay. Of course, both the needle and the syringe should be sterile. Okay. And now the good thing is that you get those needles which are like they are one time use, so they are sterile, right, and they are used once, right. And another precaution is that once you use it, that needle and syringe needs to be destroyed, okay, at that particular time, right. So there are two instruments. One is the needle destroyer, okay, and another one is the syringe destroyer, right. So what happens, uh, you have to put that needle in that box, okay, and in that there is a element which is very hot. So once the needle touches it, the needle get destroyed, right. And in another tube, when you put that syringe, you just need to cut it, okay. So there is a blade and it cuts your syringe, right. We do this so that those needles and syringes cannot be used again, right. So all the labs have to follow this practice of destroying the needle and the syringe, because we heard sometime of a news that the rag pickers, they were picking up those needles and syringes and were giving it to companies and they were using it again, right. So that is one thing. So sterile is okay, but another problem is, what if your skin is not sterile? So what we can do in that condition? Anyone?
Pardon, sir?
Your needle and syringes are sterile, but your skin is not sterile. So what we can do? Yes, Manaswini?
So you can put a bit of alcohol on the skin to kind of clean it.
Yes. So I'm sure you know. Yes, Devanshi?
Sir, the same answer as
Yes. So you all know that we first apply spirit, right? So it's alcohol. So we first clean that particular area from where we have to withdraw the blood, right? The reason is that there are a lot of pathogens on your skin, right? And what you are doing, you are pricking the skin, okay? So the pathogen which is outside on the surface of your skin, they get an entry into the vein, right? So you are directly putting those pathogen into the bloodstream, right? So that can be harmful. So first we need to clean that area with alcohol. So if there is any pathogen in that area, it would be killed, right? So that you are not injecting or putting those pathogens into the body with the help of that needle, right? So your skin should also be made sterile before you prick uh, the skin. Okay. Okay, students. So I'll just stop here. I'll quickly take your attendance and then maybe we can end the class. Okay. And again, I'm sure mm, today we just discussed one of the technique, which is withdrawing blood. Okay. So, but that's a very important step, because then everything depends on it. Once you withdraw the blood, only then you can separate serum. Only then you can think of your experiments, like if you have to do ELISA, flow cytometry, Western blot, whatever you have to do, you first need that sample. Okay, so blood collection is a very important technique, and I'm sure many of you may get uh, the chance of actually withdrawing blood uh, when you are in your doctorate, right? Okay, so students, be ready for your attendance. And if again you have some questions, I think we again have a class tomorrow, so we can take up more questions tomorrow. Okay. So Adish.
Present, sir.
Okay.
Yes.
Asalba.
Present, sir.
Ayushi.
Present, sir.
Devanshi.
Present, sir.
Ishita.
Present, sir.
Ishita. Janvi.
Present, sir.
Kshitij.
Present.
Manaswini.
Present, sir.
Namrita.
Present, sir.
Nehal.
Present, sir.
Okay. Rupal.
Present, sir.
Sahiba.
Present, sir.
Sanjana.
Present, sir.
Shak.
Present, sir.
Okay. Sanjana, you were not visible. Okay. Shivani.
Present, sir.
Tanvi.
Present, sir.
Tridev.
Present, sir.
Tridev, you are not visible. Vivek is having some network issue. Yukta.
Present, sir.
Okay, Tridev. Yukta.
Sir, present.
You are not visible. Yuvraj.
Present, sir.
Okay, okay. So, students, I think we can stop here, and I'm sure if you have any questions, and after today's discussion, I think I'm sure you'll have more questions. So, we can discuss them in the next class, and the procedure will take in the next class. Okay. So, I'm ending the class now.
Thank you, sir.